it's me again. My name is Sue and I'm a physiotherapist practicing in Singapore. Today I'll be talking about carpal tunnel syndrome. Carpal tunnel syndrome happens pretty common, okay, and the symptoms that comes with it is usually numbness and tingling sensation around the first 3 fingers, and sometimes it will go up to the whole hand, and in severe cases you get weakness in the hands. So there's a tunnel that's within our wrist that allows structures like the tendons or nerve pass through from the forearm towards the fingers. So carpal tunnel syndrome happens when the major nerve in the tunnel, we call it the median nerve, get compressed or squeezed. That's why you have numbness or tingling sensation around the first 3 fingers, okay, and in severe cases also it's the whole hand or sometimes even weakness in the hands. So people who are prone at getting carpal tunnel syndromes are people who use their wrists a lot. So usually people who are using the mouse a lot, okay, who involves a lot of repetitive movement, or people who needs to place their hand in a very awkward position during their work. For example, like a dentist, they tend to need to put their hands like this during work, and in a prolonged period of time the space is narrow and also it compresses onto the nerve. Okay, so I would like to share some tips to help to relieve the symptoms. So most importantly, some people get the numbness and tingling sensation at night when it disturbs their sleep. So what we would suggest is to wear a night splint around the wrist so that you place your wrist in a neutral position, because most of the time when we are sleeping, we are not aware of our position. Sometimes we are sleeping on our wrist like this, or sometimes even like this in an awkward position. So with if like this, in the morning we'll get more symptoms. So with the splint, it will help to relieve the symptoms in the morning. Secondly, watch your form. So if you are using a big mouse, okay, try to put something below the wrist, like a cushion, a small cushion, so that the wrist will be more neutral, and then that will help with the symptoms as well, and also take breaks in between. Thirdly, if let's say your work requires you to do a lot of gripping movement, or for example, if you need to use the screwdriver a lot, make sure your grip is comfortable. If the screwdriver, the diameter is too small, increase it so that the grip is nice and comfortable, so that you don't need to grip it too hard. So I would like to share a couple of exercises for carpal tunnel syndrome. Firstly is to stretch out the forearm muscle, okay, in front here, and the other one is to stretch out the other one, the extensors of the forearm. Okay, so for the flexors in front, what you need to do is to reach your arm forward like this, place the palm facing up, and then use the other hand to point, push the fingers downwards, and then you should be feeling some stretch around here. So you can hold it there for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is to stretch out the forearm, the flexors here. Okay, you can repeat that for 3 sets. And the other one will be same thing, placing your arm up like this, but the palm facing down instead. And push the fingers down like this, and then hold it there for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You can repeat this for 3 sets of 10, and you can do that throughout the day during your work. So thank you for watching my video. Hope you learned something from it, and if you like it, please share it with your friends and family. If you have any comments, please